This patient was referred to me for endodontic retreatment of tooth number 20. According to the patient, the root canal was done originally 8 years ago, and 2 years ago it was redone by an endodontist. Patient states she has had no symptoms with the tooth ever since the endodontist redid the root canal, but her dentist saw something on her x-ray and wanted that root canal redone again, because the dentist told the patient that the root canal had failed. And take a look. This is what the dentist saw on their x-ray, that dark shadow associated with tooth number 20. So again, patient states that she has had no symptoms, no issues with the tooth. So what do we do in this case? What would you do in this case? Would you go right away to redoing the root canal? I don't do it that way, because this patient has had no symptoms. The tooth responded within normal limits to percussion palpation. Probings were 2 to 3 millimeters all around. There was no swelling, be it facial, extraoral or intraoral. I requested, did some investigating, took some time. I saw this patient about a month ago, and it took us about a month to finally be able to get x-rays from the endodontist and the dentist who did the root canal originally, and then 2 years ago was able to get those x-rays because we're thorough. We just don't do something unless it's absolutely needed. Okay, so and that's, I hope I can relay this message to you guys as well. Don't do it unless you're sure that the patient will need it, because it's unethical. If you do something that the patient doesn't need, it's unethical. Or if you're lazy and don't want to do your homework, don't want to be thorough, and that the patient suffers either financially because they would have to pay for it, or mentally and emotionally, it's unfair and unethical. So again, you can see that dark shadow right here. But because the tooth was within normal limits to all my tests, we finally able to request x-rays, and these x-rays are from 2 years ago. And take a look. Look how much larger this periapical radiolucency was 2 years ago, and how much smaller it's gotten. The first x-rays I showed you was x-rays that we got about a month ago. These x-rays are from 2 years ago, before the root canal was redone. As you can see, the fill is short. All right, so if I put these x-rays next to each other, take a look. So this is the x-ray from a month ago when patient first came to see me. You see that dark, that periapical radiolucency. This x-ray is from 2 years ago, before the endodontist redid the root canal. Look how much larger the periapical radiolucency was 2 years ago, how much smaller it's gotten. So we don't have to redo this root canal for this patient. The periapical radiolucency is actually healing. The infection is already gone, and the patient's body is regenerating bone. So if I had gone straight to redoing the root canal, I would have done it unnecessarily. I would have actually harmed this patient. So remember, do no harm. So this is how you work up a tooth. Be thorough, be caring, be passionate. Imagine all your patients. Imagine your patients, all your patients are your loved ones. Do your patients right. Be fair, be honest, be ethical.